Good morning, everybody. Thank you so much for joining us. I'm Jim Skogsbergh, President and CEO of Advocate Aurora Health. We really appreciate you being with us here today for our 10th virtual town hall focused on kids, COVID, and the vaccine. Based on your feedback, we've shortened the length, but we'll pack in a lot of good information and answer as many questions as we can in the half hour. We know there's one big question that many parents and grandparents and other caregivers have been asking, and that is it safe for kids to get the COVID-19 vaccine? Today we're going to answer that question and many more with our experts from Advocate Children's Hospital and Advocate Aurora Health. It's an important time to talk as the country's vaccination program is giving us hope and literally a shot at a more normal life. More than half of U.S. adults have received at least one dose, but there are worrying signs we may be approaching a plateau as new daily vaccine has dropped in the month of April, and many vaccine locations now have more supply than demand. COVID cases in both Illinois and Wisconsin remind us that we are not out of the woods yet, which is all the more reason to think about your child's overall health, what you've been putting off, and how you can get them the care they need in 2021. First, I want to introduce our experts. With us today is Dr. Frank Belmonte, Chief Medical Officer for Advocate Children's Hospital, and Dr. Markeita Moore, a pediatrician with Advocate Children's Hospital. Both have continued to be go-to sources throughout the pandemic. Thank you so much for being here, folks. Can you each just take a minute to introduce yourself more fully, perhaps education and training? Frank, let's start with you.
Thanks, Jim. So I'm Frank Belmonte. I'm the Chief Medical Officer at Advocate Children's. Been in that role for 4 years, but been a part of the Advocate Aurora team for 17 years now. And I'm a primary care pediatrician by background.
Very good, thank you. Dr. Moore.
Hi, and so I've been in pediatrics for about 10 years, and I've been with Advocate for the last, 5 years now, and I also trained at Advocate, too.
Very good. Thank you both for being here. So lots of questions coming your way. We've got about 30 minutes, actually less than that right now, but I have to do this before we dive in. Some housekeeping notes for our viewing audience. First, submit your questions, please. We'll try to answer as many of them as we can in the time available. Second, we're going to make this video available on our Advocate Aurora Health Facebook page for later viewing, and that's going to have closed captioning with it. Finally, I want to mention while we are not masked currently, you can see our smiles, we came in with masks, right? And as soon as this session is over, we're going to put them right back on. Even though we're vaccinated, all of us are vaccinated, it's important to keep doing that while in public. We're going to get to more post-vaccination guidance in just a bit. All right, so let's get after it. Here's your first question, and we'll start with you, Dr. Belmonte. Tell us where things stand right now for vaccines with kids. I know that this is a little more complicated than with adults. Which children can get the vaccine? What are we still waiting on in terms of guidance from the FDA?
So both states decreased their eligibility criteria down to age 16, and that was about a month ago. And at the same time, Pfizer also filed for the emergency use authorization for the 12 to 16-year-olds. So we're waiting on that, and we hope that any day now the FDA will okay the vaccine for that age group as well.
Yeah. Dr. Moore, any additional comments? I mean, still down to 12, but we were talking before we went on air that there's actually some testing being done on, is it down to 6 months?
Down to 6 months.
Yeah, and we'll get to that a little bit more in a second. Okay, so as pediatricians, I'm going to start with you, Dr. Moore.
Okay.
As pediatricians, do you recommend children get the COVID vaccine? Everybody wants to know, is it safe?
It is safe. Yes, we highly recommend it, us and the AAP, because kids right now, I think like the last week of April, they were like 22% of cases of all COVID cases was pediatric cases. And in like Illinois, there was about 6,500 per 100,000 children that would get COVID, and in Wisconsin, about 7,500 per 100,000.
Okay. So no debate, no discussion. You guys are both all in on the COVID vaccine for kids.
Absolutely, and actually in that 12 to 18 age range, there's about a 20% transmissibility. So even if they don't get, really sick from the virus, they can spread it to family members or to other vulnerable folks in their community.
Yep. Okay, next question. Throughout the pandemic, we've heard that children have not been impacted as much by COVID-19 as adults. Do children and teens really need the vaccine? Similar veins in terms of question, but and I know you just made some comments about that, but let's go ahead and answer the question as these audience members have brought it to us.
I mean, I can start with the inpatient side of it. We've had kids hospitalized since the beginning of the pandemic, some who have been quite ill. We also, in June of this past year, started to see the inflammatory syndrome that we had mentioned before during these sessions, and those kids can be very sick down to very young ages, down to toddler ages.
Yeah, and with the Miss C, there was about like 1,000 cases in October, and then by February it was over 2,000, and close to April we've over 3,000 of the Miss C cases now. So it's very important.
All right, so got to get that vaccine. So next question. For understandable reasons, there continues to be vaccine hesitancy in communities of color. What is your message to parents who may share that hesitancy, particularly when it comes to their children? Are you dealing with that in your office, Dr. Moore?
Yes, so it is it's understandable why they are hesitant because of the mistrust, but so it's my job to instill trust and just to listen and to see what their fears are and to give them everything that I've learned just so they can see that it's safe, and to also lead by like example as well, and just to be like a listening ear.
Now, I know you're an N of 1, actually N's of 2, but is the hesitancy simply around race? Or do you have all kinds of moms and dads with some hesitancy?
I mean, I think there's folks that are anti-vaccine, and that goes beyond COVID. And then I think there's a group that's just nervous. They don't understand the science. They don't understand, the premise of the vaccine. And then I think, and Markeita, you and I have talked about this, that race does play an issue in this.
It does.
Yep.
So it's a lot of mistrust that we're still trying to build up.
Right, and I love that comment, Dr. Moore, about, hey, I'm the one that they need to trust, right?
Right.
I'm the trusted advisor.
Yes.
And they're lucky to have both of you. Next question. How do I get my child the vaccine? Will they know which vaccine is approved for children and teens? So now we're back to this J&J, Pfizer, Moderna. So comment both. How does a parent get their kid vaccinated? And does it make a difference which vaccine?
So we're doing a lot of work on the back end to make sure that the right child gets the right vaccine. As you know, the Pfizer vaccine is the first that applied for the EUA. So when we get word about that, those 12 to 16-year-olds will be eligible just for that vaccine. So within our organization, we've put safeguards in place so that you can only schedule at sites that have the vaccine. And really, you go on to AAH.org and you can find all that information on how to schedule.
Yep. And I also know, and I think the audience will be pleased to know that we have a lot of Pfizer vaccine.
Right.
We've kind of reached that stage where the supply outpaces the demand. So when we open it up to these kids down to 12, we're going to have plenty of Pfizer. And I'd go so far as to say anyone who wants the Pfizer vaccine should be able to get it. So we feel good about that. This is speculation, but we're asking you to comment as caregivers. Will my child need a vaccine to get into school this fall?
So far, they have not made any requirements. There's only certain colleges that have instilled it, but not any elementary schools.
Do we expect from higher ed, do you believe that because colleges, some higher ed is doing it, is it going to trickle down? Do you expect that we might see that eventually? Or do you think once the vaccine's out there, we're not going to force it?
Vaccine requirements are state by state, but I do foresee that in the future we would see COVID as part of those vaccine requirements. And Markeita, you and I have been talking a lot about parents asking about the vaccine in the office. So
every day.
You want to comment on that?
They always ask if they can, have the vaccine, and do we have it here? And they are willing, even for kids less than 16, they are willing to have a vaccination there too. So we do have a demand. We just need to get the EUA approved.
Yeah, well, that's good news that people are asking for the vaccine, and how do I get it? Here's another question. One important trend we've seen in the news and in our own data is that many people delayed care for their children this past year. This notion of, I don't want to take them out, don't want to get them exposed, so they've delayed care. With our backgrounds in population health, we know the importance of getting these regular checkups and screenings and immunizations. If parents and caregivers haven't already, is it time to schedule those appointments now?
Yes.
That's kind of a fastball down the middle. Don't miss this one, right?
This is a strike, yes.
Exactly.
Yes, definitely, because we've had some kids that missed last year, so they missed 12-month vaccines, they missed 15 months, 18-month vaccines. So now we're doing catch-up.
And are you seeing a lot of that in your office? I mean, people are kind of now coming back and doing a lot of catch-up?
We are, and I think what we're anticipating, we're already starting to see, is the other effects of the pandemic. So children with behavioral health issues, with obesity, with hypertension. We are going to find a lot of stuff during that child visit over this summer.
So I love that. I'm a grandfather, so I love this question. How do I convince my hesitant children to vaccinate my grandchildren? So here's a grandparent saying, I want my grandkids vaccinated. How do I get my children to do that? What's the conversation in the audience? How do you move people to action?
By listening first. First, you have to listen and see why are they hesitant, and then just address that, and to tell them to speak to their doctor, and also offer free babysitting if they're vaccinated.
There you go. Free babysitting.
I would also just add that, we know a lot about vaccine science, and actually pediatricians are experts in vaccine science. That's what we do on a daily basis. We know just a little about COVID virus. And so I think we understand what we know now, but we don't understand the long-term side effects of the COVID virus. So protecting yourself is really important. We don't know what's going to happen 5 years down the line.
Yeah. And that, interestingly enough, Frank, leads into the next question. Will children have the same side effect that adults have had with the vaccine? So you mentioned we don't know that much about COVID-19, but we do know that some adults have had side effects. Are we expecting 12 to 16, 12 to 18? Will they have some side effects as well? What's the science tell us thus far?
So it tells us that they will have the same type of side effects as the 16 through the 25 group, which is injection site pain, which is fatigue, which is headaches. So those are the most common ones.
Yeah, and it comes and goes, right?
I mean, it's not permanent. It's transient for about 24, 48 hours.
24 to 48 hours. Yep. So and then of course what we always say is that the side effects are so much less significant than actually getting COVID, so the advantages far outweigh the disadvantages. All right, next question. How do I make sure my child gets the FDA-approved vaccine for his age and not one that is not yet approved?
I think, like I said, we're putting the safeguards in place, not only in our organization, but at the state level, both in Wisconsin and in Illinois. Of course, right now, it's going to be Pfizer for that 12 to 16-year-old age group, and that's what you want to ask to make sure that it's Pfizer.
Pfizer.
Right.
Do you have any insight into when the others might be approved for lower ages?
I think this summer we're going to see a lot of activity here, especially as we start to vaccinate this demographic.
Got it. All right, next question. How do I talk to my 18-year-old son who does not want to get the vaccine? Can a parent force the issue at his age?
We wish we could, but we can't. At 18, it's their choice, but once again, it's communication, because at 18, they want to feel like that they're in control, and it's their choice. So just present to them all of the facts of its seriousness, the life and death of it, and that they can have a sense of normal life with the vaccination.
I think as pediatricians, we're good at empowering adolescents and teaching them how to be adult, responsible for their health care. So use your pediatrician too. Let them talk to your child. So it's not a parent-child struggle.
Absolutely.
It's more coming from a professional.
And in this case, 18, young adult, really. So is there a source that you direct people to? Like you have conversation in the office, but then if you're saying, hey, you want to read some more about this, do you have favorite sources that are go-to that you would advise perhaps an 18-year-old, hey, go read about this?
The AAP, the CDC sources, those are the big ones with the actual factual sources.
And our Advocate Aurora
AAP,
Health.
American Academy
I'm
of
sorry,
Pediatrics.
yes.
So for our audience,
And Advocate Aurora Health has some great resources on the website as well.
Yep, very good. Okay, I have a child, everybody can relate to this. I have a child who hates shots. Is there a certain age when a teen's desires are considered before going forward with a vaccine? Is there a certain age when a teen's desires are considered before? So you have fear of needles.
Oh, fear of needles.
Yeah.
It's more of a soothing technique, and we ask them not to look, but the choice is ultimately the parents' choice. But we do listen and we do help them through it. Kind of like child life acting.
Most of the time we're really successful at it, talking them through it, deep breathing,
Got it. All right, here we go. Is my unvaccinated child at risk if all the teachers in school are vaccinated? So again, hey, teachers, kids are vaccinated, mine doesn't need to be, I think is perhaps the thought process. Speak to that.
So herd immunity is really about the whole community participating. And, I think if we had that idea that each and every one of us is an individual, we're not going to get to where we need to be to prevent the spread.
So this is not a question that's come up yet that I'm reading, but I want to ask you both, and I really meant to start with it. You're both parents.
Right.
You both have children. Dr. Moore, yours are too young right now
Right.
for it, but who knows in the next
But the
few months.
4-year-old wants it.
The 4-year-old
Because
wants
he's tired of the mask, so he asked for the shot.
Yeah. Dr. Belmonte, yours are old enough, at least one of them. Has your children received the vaccine? Will your child receive the vaccine? Talk a little bit about your own as parents.
So I have a 14 and an almost 16-year-old. So she knows the minute she turns 16, she's getting it. And if the EUA is approved, we're going right away. I think they've heard me talk about it so much this year that they just want to get it over with. And I think that they realize the importance of it. So, yeah, kids of pediatricians are a little different.
Yeah, they are.
Yeah, yeah.
They are.
And yours ages are much younger,
Yes,
correct?
mine are 7, and the 4-year-old will be 5 next week. So
Okay.
the 7-year-old doesn't like shots, so he just likes to wear his mask. So that's going to take some talking to.
Right.
But the 4-year-old is ready.
Got it.
He wants the shot right now.
Got it. And neither of you would hesitate once
No.
the vaccine's approved?
No.
Yeah. Thank you. All right, next question. Let's see. Is it safe for my child to get regular immunizations at the same time that he gets the COVID vaccination? If not, which should be a priority? Any order in which they should go?
The COVID vaccination first, and you have to wait 2 weeks. So in actuality, it'd probably be like 6 weeks because you have the first dose, then dose number
Yeah.
2 4 weeks later, and then you wait two additional weeks, unless you have some other medications or like plasma issues. There's normally about 90-day wait between the vaccinations.
Okay, and obviously the pediatrician's
Right, and the
office is gonna
pediatricians will know about that.
Right. But COVID first. Get that
COVID
first,
first.
and then get the other
Yes.
vaccinations.
Yes.
Very good, thank you. If my child returns to college and his roommate is not vaccinated, what would you suggest I do as a parent?
So give your child a sense of control and give him protection with the vaccination, because you can't really control other people, but to just increase cleaning and to ask that unvaccinated person to wear their mask. But you can't social distance in a dorm room. I've been in one. Those
Right.
are pretty small.
Right.
But just frequent cleaning.
I mean, and if there's discomfort, especially from your child, you need to go to administration and
see about
figure out
changing.
if there's a different way to do it.
Yeah, it's interesting. I read the question. I was wondering if schools are now trying to match up
That's
vaccinated, unvaccinated, that sort of thing. And many of them, as we talked about earlier, are requiring vaccination to come back to campus. Next question. In what cases should I consult my pediatrician before getting my child the vaccine? So would you say to your patients, just go and get it, or do you actually want to have some conversation, some consultation before they do?
I would say the great majority just go get it. There are kids who have chronic medical conditions or who are in active treatment for cancer. They would want to talk to their specialist before they make any appointment or get any vaccine, but the great majority is just go get it when you have the opportunity.
Okay, very good, thank you. Let's see. Should all kids get it, or are there exceptions? What would the exceptions be?
There aren't really any exceptions, except for if you have like a severe anaphylactic, reaction, but then you would have to have dose 1, for that. So there haven't been any exceptions.
There are a lot of questions in here, as you might imagine,
Okay.
the unique needs of my child.
Absolutely.
And I think what I've heard you say is really no exceptions, but when in doubt, have
Talk
a conversation
Absolutely.
with your specialist, your pediatrician, et cetera. Okay. Let me see. My husband is a holdout, and I need some help convincing him. So we're not talking about kids anymore. We're talking about adults here for a minute. And I suspect that the advice is the same as what you said earlier, right, in terms of conversation, get educated, and so on. Any additional?
I mean, I've seen really success within families because they trust each other. And so, talking about your concerns and, getting the physician involved if you need to, that's really the best. The discussion is what needs to happen.
Absolutely.
Yeah. I have a comment here about that being a child isn't always just chronological age, right?
Right. No.
Correct.
No, it's not.
I can relate to that. Okay, next question. Should my child be vaccinated to go to summer camp this summer, or is it safe to send her even if we don't get her immunized by then? So, yeah, I mean, the question is, should I send her to summer camp with or without the vaccine, right?
Yes, you can if the summer camp is going with the CDC's guidelines as far as safety, as far as masking, social distancing. when possible, ventilation. So those are the key things.
Being
And
outside.
hand, and
Yeah.
hand washing.
So you would say, go ahead and send her to summer camp, get her vaccinated when you come back. Is that sort of what you're...
Right, if that summer camp is upholding the CDC guidelines.
Got it.
And remember, those younger kids are not going to have access to it just yet. So there are no other options for them.
Right. Yeah. Social distance, mask, wash your hands. Yeah. Got it. All right. Will getting vaccinated ensure my child can play contact sports this fall? That whole thing about athletics, right? What's the latest?
I mean, the state organizations have some pretty strict criteria. My youngest plays soccer, so she's been playing soccer, outdoor soccer throughout.
Are they masked during the play?
They're masked during the play. The parents are distanced on the sidelines. We're all wearing masks. So you just want to make sure the club or the team is following the guidelines. As long as you're following the guidelines, you should be safe.
Right. Now, this question is, can you ensure my child will be able to play? We're not sure.
No.
Is it school by school or state by state?
States have a big, say in it.
Okay.
Yep.
Okay, got it. All right, so we're asking some science here.
Okay.
What happens if we don't get to herd immunity?
I am leisure. No.
Yeah. It could just take a very long time to extinguish the virus. So we will be dealing with it for many years if we don't. And we learned a lot from the pandemic we had back in 1918 with the flu. That was 3 or 4 years. So I think the fact that the science is where we have it now, we were able to develop a vaccine in short order. We're so very lucky that we have access to this. So we need to take advantage of it.
Yeah, it'll be a roller coaster.
And correct me if I'm wrong, but the longer it takes to put this out, put this fire out, the more opportunity to mutate, right? So we have another strain and then another strain, and it'd be better to kind of put the fire out right now. If
Exactly.
we could. Yeah.
Instead of going like phases and
Exactly.
then going backwards.
Yeah.
And we may see a decrease over the summer just like we did last summer. But going into the fall, we could see a resurgence if we don't get to critical, vaccine levels.
Absolutely. Next question. I think we spoke to this, but let's deal with it as it comes up. If 12 to 15 is the next age group, when can we expect kids under 12 to be able to get vaccinated?
Well, there was an article that said that Pfizer might apply for EUA, that's emergency use, for 2 through 11 in September. So
yet this fall, application for 2 through 11.
Right. So which means that it would still take time for review process.
Right.
There's hope by the end of this year we will be vaccinating those younger kids.
Yep, by the end of this year perhaps.
Correct.
Very good, very good. Okay, if your child is high risk now and the vaccine comes out for their age, should they still protect themselves as if they weren't vaccinated after they get vaccinated? So it's that notion, like you and I mean, all of us, we've been vaccinated and yet we're still putting our mask on, we're still washing our hands, still maintaining social distance. I don't know about camera angles, but everybody in here is at least 6 feet apart. And that's the question that's being asked, and I suspect the answer is yes, right?
Right.
The CDC has done a great job updating those recommendations as we get more folks vaccinated. So I would look at that website. It tells you exactly what you can do, what you can't do. If everyone in the household is vaccinated, there's a little bit more, you could be a little bit more liberal about it. If there's folks you don't know, if you're in public, then you need to follow the mitigation strategies.
Right,
Absolutely.
right. So back to science for a moment,
Okay.
ask both of you. Are there any other mRNA vaccines that our children receive routinely?
No.
mRNA, this was the first time we've used it in a vaccine, although the technology has been available for over 10 years, over a decade, which is why we were able to produce this so quickly, because we've had the technology, we just haven't applied it yet.
Got it. So first time for mRNA vaccines for kids. Got it. Next question. When should we expect FDA extension of the EUA, emergency use authorization, for kids 12 to 15? Will you prioritize vaccine availability immediately for your most high-risk patients age 12 to 15? That's a good question. And then adults with high-risk conditions were prioritized, but high-risk kids will have to compete with everybody else, question mark.
No, with Advocate, when we became open for 16 and up, we prioritized based off of health risk. And we would do the same for 12 to 15, from what I believe.
We've put a lot of structure in place in the organization and through the Children's Hospital to identify and proactively outreach to those kids that are at highest risk.
Got it.
And we'll do the same when we get down to 12.
Got it. So we will prioritize high-risk kids. Very good. Thank you. Is there a possibility with Michigan showing more young adults and children getting hospitalized, that the virus is now attacking them since most adults are now vaccinated. In other words, does the virus seek a home and can't get to you, can't get to you, can't get to me because we're vaccinated? Therefore, is that how it works?
I think this is a good question. I think it's multifactorial.
Right.
The variants are emerging, so that's affecting different populations in different ways. We also know that as folks get vaccinated, people get a little lax with the mitigation strategies, and that could also be causing transmission. People are just tired.
I know that. That's a whole other topic,
Yeah.
isn't it?
Yeah.
About our willingness to endure, discomfort or sacrifice for a period of time, and it seems like our limits are fairly low, which is a whole nother conversation about our society. And not one of the questions here.
Okay.
Is the vaccine safe for kids with seasonal and peanut allergies and asthma?
Yes.
Yes.
Okay, that's a firm yes. So, is the vaccine required for travel?
It is not required for travel, but is highly recommended, because once you get through with the 6 feet, distancing in the airport, you're sitting right next to somebody. And then if you have to drink something or if you have to eat something, you're going to have to, take the mask off. So to be safer, it is highly recommended that you get the vaccination. And with some places, if you are vaccinated, then you don't need to have any testing done.
Okay, very good. Thank you. So here's a question. My son just turned 11 and is at high risk of complications from COVID because he has special needs and has a lot of medical complexity. When will his age be approved, or will there be an exception for the high-risk kiddos?
No exception. We have to go with the EUA usage. So hopefully for him by the end of the year, hopefully.
Got it. So no exceptions, but hopefully by the end of the year. All right. Will the vaccine be tested on children with rare genetic or chromosome disorders? Has it been tested, do we know, on that population?
No, I mean, we'll be giving it to those kids because of the science, and we know what we've learned. We've done tons of vaccines across the country now. We've learned a lot. So those kids will be eligible to receive it.
Got it. And I have just got the warning that we're just about out of time. Last question. Is the dosing the same for children as it is for adults?
That so far it has been, and they've been testing different doses for the different age brackets.
Right, so for the 12 to 16, it'll be the same that we're giving the adults.
Yep, very good, thank you. And I know we did not get to all these questions, but we are out of time, unfortunately. I want to thank all of you for the great questions you submitted, and I certainly want to thank Drs. Belmonte and Moore for sharing their time and their insight with us today. We are so appreciative of your wealth of knowledge, really. Thank you so much. And while we can't be on Facebook Live all the time, please visit our website, available in English and Spanish, for the latest news and information on the vaccine, including how to schedule an appointment. I also recommend you follow our social media channels and download our LiveWell app, where you can get all your health information in one convenient place. One more ask. Your feedback is important to us, and we want to hear from you. Please take 2 minutes to fill out the survey. Okay, folks, that's it. Spring is here. Summer's around the corner, but please continue to wear your mask, social distance, wash your hands, and if you haven't done so already, get your vaccine. Until next time, stay safe. Thanks for watching, everybody. Goodbye.